going on, everyone? It's Alex here from Alex Physio. So today we're going to be going over a spine anatomy overview. I do a quick anatomy overview with regards to the spine. So basically we have our vertebrae, or the bones of our back. We have 5 in our low back, 12 in our mid back, and 7 in our neck. We have discs in between each vertebrae, which are like the shock absorbers, okay? And then we have our spinal cord, this yellow structure right here. It runs from the base of your skull as an extension from the brain stem, and it travels all the way down in the middle of this canal, down into our low back. It doesn't go all the way into our low back. It usually ends at about L1 or L2 area. And then from there, you have nerve roots that continue to fan out from that area and travel all the way down into the rest of your low back. And from the spinal cord, you have these little nerve roots that branch off the spinal cord like branches of a tree, and they exit out of these little tunnels here on the side. These are called your neural foramen. So you have your central canal, and then you have your neural foramen, which are like little exit ramps, and the central canal is like the main highway, just to use a car analogy. So these nerve roots, they're obviously cut here for illustrative purposes, but in the low back, they travel all the way down into your foot and toes. The mid back, they travel around your dorsal region, and in the neck, they travel into your hands and fingers. And these nerve roots have 2 jobs. The first job is they send electrical signals to the muscles to tell them to turn on. And the second job is they receive sensory information from your skin. So hot, cold, touch, pressure, vibration. And they send that message up to your brain via your spinal cord so that you know what part of your skin or area of your skin is being touched. Each nerve root is correlated with a certain muscle action or actions in an area of your skin generally. Obviously, there's some variation with the individual anatomy. But basically, when you are seen for a consultation, or if you're seen by a spine surgeon, or even if you go to a physiotherapist's office, if you have back pain, neck pain, or mid-back pain, the purpose of the neurological exam is to basically look at the health of these nerve roots to see if there's any differences side to side, and to look at the health of your spinal cord. And how do we do that? To assess your strength, assessing your sensation, assessing your reflexes, upper and lower body, and then certain other tests to basically look at the health of your nervous system. The reason we do that is we're looking for any weakness, any numbness, tingling, or any red flag findings to indicate either further interventions or further investigations, such as more imaging, or interventions such as surgery or physiotherapy or injections. And that neurological exam that we do will be guided based on the results from the exam, and then also just from the answers to the questions that we ask you with regards to what's causing your back pain, neck pain, mid-back pain. I find that everybody learns differently, so being able to explain using a spine model just kind of what's going on and what the makeup of your spine is can help to conceptualize a little bit more, and hopefully helps you understand a little bit more what's going on, what the purposes of some of these nerves are, and what the function is of some of the bones and the discs, and what can happen when there are injuries to the nerves or to the bones or to the discs. And with people who primarily present to the spine clinic, usually it's for sciatica or radiculopathy, or basically a nerve is being pinched and irritated, which is causing that classical pain running down the back of your legs. And usually this can happen as a result of arthritic changes or a disc herniation. And usually when the disc herniations happen, they happen backwards and kind of out to the side. So if you can appreciate, if this tunnel, or if this nerve is running out of this small little tunnel here, if you have a disc herniation or some arthritic changes that affect how wide that tunnel is, and if it gets narrowed because of those changes, then that can sometimes irritate or compress that nerve, which can cause some of those symptoms. Now, some people can have findings on MRI and not actually have the symptoms, even if there is evidence of compression or severe narrowing of the tunnels. So it's always important to try to correlate the objective examination and the subjective history and what your primary complaints are, to see what the correlation is between the two. Hopefully you learned a thing or two, a little bit about the anatomy of the spine, some of the structures associated with it. Do you have back pain, neck pain, or mid-back pain? What has your experience been like with the healthcare system? Let me know down in the comments below. Until then, we'll see you in the next video. Thanks for watching.